Hello, my name is Godfrey Palmer and I am a cancer patient. I'm still receiving treatment at Addenbrooke's Hospital, which is ongoing. So first I had an ulcer just at the top of my ear and it was sore and it felt like there was an infection. So I had that for 4 months and I went to my GP to check it out. And they realised actually that needs to be checked out by the hospital. So they sent me to Hinchinbrook and they said we'll need an operation to remove it. And they stitched it up, removed it, seemed fine, it was successful. But a few weeks later, it started to grow significantly here on my neck, and it was getting bigger and bigger and bigger. So we went straight to my GP and they said, no, urgently get to the hospital. So Hinchinbrook then sent me on to Addenbrooke's because it was severe, and they said, yes, we need to treat. And so we continued treatment, going back and forth since then. But I had to keep going back to Addenbrooke's for the treatment, and then they said I needed immunotherapy. So I accepted that, but there were 2 top doctors there who were debating between an operation or going through the treatment. And so we decided it was best for me, for my case, to have the immunotherapy. And so I've been on that since March 2024 until now. Early days was really tough. You know, I didn't know what was likely to happen. I didn't know the options available. Since starting treatment, the first, second, third, fourth, I've been much happier. I'm on session 15 now and I'm so happy. You know, I feel like it can carry on, and the doctor said I might need to do this for 2 years, but it doesn't matter. I'm happy. Okay. It wasn't like I thought it was. Obviously, we've heard more about chemotherapy, but it was very different because obviously you might lose your hair and things like that, but immunotherapy is different from that. And now I feel I understand it more. So when I went the first time, I was told to be careful because of the side effects that can occur, and well and truly there were side effects. They were quite significant. But luckily, after the first few, the side effects have died down quite a lot. So, for example, the first time I had immunotherapy, on the very first day, it was awful side effects. So I was completely wiped out. I got rushed to hospital in Peterborough, or was it Addenbrooke's? I can't remember. I think Peterborough. Oh, that's a Hinchinbrook. So went to Hinchinbrook Hospital and they said, oh no, you're going to have to go to Addenbrooke's because these were quite severe side effects. And the Addenbrooke said, yeah, that could happen. So they gave me some tablets to manage the pain. And with patients, the side effects did begin to reduce. They've increased as well whilst being on therapy. And family have advised me to keep going back to hospital, but they are slowly reducing, and now it's getting more manageable. It sometimes fluctuates, the side effects, but it's got to a point now where I'm quite used to it and it seems to have smoothed out. And so at the moment, I'm not experiencing side effects. The first time I had immunotherapy, they did warn me that it could grow and get all of the pus and the blood out. And so the skin was torn as well at this stage. Really painful. and it grew, and that's when I had to go back to the hospital because we were worried about this growing quickly. So the second time the immunotherapy, it was almost gone. It was like it is now, like this. You know, it went down drastically fast. I think definitely the hospital. It was very, very useful having the interpreters there, but the hospital gave me fantastic treatment. CDA have helped a lot with the befriending service, sitting with Catherine, but the hospital have helped a lot with treatment and making sure the interpreters are there. So yeah, the hospital have been fab.